Welcome to part 2 of chapter 4, Human Digestion, Absorption, and Transport. In this chapter, we're going to look at the terms prebiotic and probiotic, and we'll discuss the roles of each. And although we will not review all of the GI disorders and diseases presented in chapter 4, we will, however, focus on two common inflammatory bowel diseases. Now, intestinal bacteria have always been an interesting topic to me, and you've probably seen or heard the term probiotic before, but you may or may not know exactly what that means. Probiotics are the helpful bacteria found in our GI tracts. Probiotic use goes back to a time before microbes were even discovered, as fermented milk products were featured in Egyptian hieroglyphs from thousands of years ago. Now, in the 1800s, positive health effects were recorded by scientists upon the ingestion of certain amounts of fermented milk products. Recall that Louis Pasteur identified bacteria and yeasts responsible for fermentation, but he never linked them to any health effects. Now, Eli Metchnikoff in 1905 claimed that the longevity among Bulgarians was caused by the lactobacilli used to ferment the yogurt they consumed, and the presence of these lactobacilli in the colon were what kept them healthy. Now, these discoveries spurred other research that looked into health promoting microbes and their role in the prevention of disease. Again, you may have seen foods that have probiotics written on their labels. And food manufacturers definitely like to feature this on their products. Sales of probiotics accounted for $39.9 billion in 2016, which is up from $30.4 billion in 2010. Consumer interest in probiotics and their potential benefits to digestive and immune health is growing each year. Now, probiotics are live microorganisms that help restore or maintain a healthy balance of good, or also you may hear them called friendly, bacteria in the GI tract. Although some food producers add probiotics to their products, they're often found naturally in fermented foods like cottage cheese, yogurt, and buttermilk. Non-dairy fermented foods, where you can find probiotics, are, and these are just a few, miso, sauerkraut, and soy products. Some newer shelf-stable strains can be found in cereal bars, apple juice, and baked goods, along with probiotic capsules and pills that you can find in the supplement areas of supermarkets and health food stores. Okay, with the good comes the bad. However, some negative press has been released on probiotics, and some scientists claim that manufacturers of probiotics are selecting bacterial strains for their products because they're able to grow them in large numbers, not because they are adapted to the GI tract or known to improve health in humans. In fact, the particular strains of Bifidobacterium or Lactobacillus found in some yogurts and pills may not be the same ones that can survive the very high acidic environment of the human stomach. Now, if they do survive, would this actually allow enough bacteria to colonize your GI tract? Many researchers are suggesting probiotics for those with existing GI issues, not those with normal gastrointestinal tracts. Although probiotics are generally considered safe for healthy individuals, more and more research is showing that the benefits are limited. So, if benefits are limited for healthy individuals, who mostly benefits from taking probiotics? Well, there are dozens of scientific studies, and they all concur that probiotics may help prevent common side effects associated with treatment with antibiotics. Adding yogurt, especially the kinds that contain lactobacillus, not only while taking antibiotics, but after a course of antibiotics, could decrease the chance for developing an opportunistic infection. And aside from those ideas that it could help after taking antibiotics, it's thought that probiotics may benefit preterm infants by possibly reducing the development of a necrotizing enterocolitis, which is an often fatal GI disease. I've included a link to a description of this condition on the slide. If you don't know anything about it, you can read about it there. Finally, studies have shown that those with IBS, or irritable bowel syndrome, may experience fewer symptoms while taking probiotics. And although it's not clear why this is the case, researchers think that the probiotics inhibit harmful microbe growth. Okay, now that we've talked about probiotics, what are prebiotics? These are the non-digestible carbohydrates that probiotics feed upon. What are good prebiotic sources? I've provided a few at the bottom of this slide. Just to name a few, leeks, onion, and Jerusalem artichokes, for example, are good prebiotics. So basically they are the food for probiotics. Now, your textbook discusses several common GI disorders, including constipation, diarrhea, vomiting, heartburn, ulcers, inflammatory bowel syndrome, and irritable bowel disease. However, I'm only going to focus on inflammatory bowel disease for the purpose of this presentation. I know that many of you are interested in celiac disease, as am I, but we'll discuss this further within the chapter on carbohydrate and then the one on proteins. Now, irritable bowel disease, or IBD, is a very broad term that describes serious chronic conditions created when the body's own immune system has an abnormal response. This usually results in inflammation of the GI tract. The two most common IBDs are Crohn's disease and ulcerative colitis, or UC. Now, although physicians reported symptoms similar to those presented by Crohn's disease for the last several hundred years, it was not until 1932 that the disease was formally identified. A man from New York named Burrill Crohn initially became interested in studying medicine because his own father had problems with digestion. He received his medical degree at Columbia University and conducted most of his medical research at Mount Sinai Hospital, where his special interests were related to the diseases of the bowel. Now, Crohn and other contributors published and presented a paper in 1932 where he explained that during GI surgeries on 14 patients, he and his surgical team came across inflammation, specifically of the ileum, often leading to obstructive masses that had not been described to date. And although he called the condition regional ileitis, the name Crohn's disease was subsequently given to the condition because of his published work. Okay, now that we know a brief history of the discovery of Crohn's disease, let's take a look at the condition itself. Estimations are that about 780,000 Americans have been given a diagnosis of Crohn's disease. Usually, that's about the age of those diagnosed is between 15 and 35. Now, the condition, which usually impacts the colon, um, it it usually impacts the colon, but it can also cause inflammation anywhere in the GI tract. And it can present itself in a variety of symptoms depending on the part of the GI tract that it affects. The most common symptoms are abdominal pain, usually in the lower right quadrant of the abdomen, weight loss, blood in the stool, nausea, diarrhea, vomiting, as well as the possibility of joint pain and skin lesions, again, depending on the type of Crohn's. The exact etiology of Crohn's is unknown, unlike many other common GI conditions that are caused by bacteria, viruses, parasites, or medications. However, we do know, and this is really interesting, that the immune system is involved and it attacks healthy cells in the GI tract. Now, scientists hypothesize that bacteria in the GI tract can mistakenly trigger the immune system, leading to inflammation, ulceration, thickening of the intestinal walls, and other symptoms associated with Crohn's. We also know that Crohn's runs in families, so there's certainly a genetic component to it. Now, how does this relate to nutrition? Well, there's no dietary treatment long term for Crohn's disease, but some foods may be gentler on the digestive system during flare ups. For instance, eating soft, bland foods like white rice or pasta, white meat, poultry, lean pork, low fiber fruits, soy, eggs, and tofu during a flare up of Crohn's will help the patient get enough calories for normal function and for healing so that hopefully remission occurs. Foods recommended to avoid during flare ups are high insoluble fiber foods like whole grains, high sugar sweets, any food with lactose, greasy fried foods, spicy foods, and caffeine and alcohol. Now, many of these foods contain FODMAPs, or fermentable oligo, monosaccharides, and polyols. These are short chain carbohydrates that many people cannot digest because they pass through most of the intestine without change. Now, they can be fermented by certain bacteria, which produce hydrogen rather than methane, and these bacteria can cause serious gas, bloating, cramps, pain, and constipation in susceptible people. Now, avoiding these foods will not work for everyone with Crohn's, but these are most commonly described as the ones that cause abdominal pain or other GI distress in those with the disease. Okay, so although there's not currently a cure for Crohn's disease, there are new promising studies coming out that may point to one day improving the lives of those living with Crohn's. Just recently, scientists in the UK reported research using stem cell treatment for Crohn's. This involves administering chemotherapy to the patient to wipe out the immune system, then performing a stem cell transplant and hormone treatments to basically grow a new immune system that does not attack the body. In addition, scientists are researching the links between Crohn's and a bacterium called Mycobacterium avium paratuberculosis, or MAP. Now, MAP causes Johne's disease in cattle, and the symptoms are quite similar to those of Crohn's in humans. MAP bacteria are often present in the blood cells of people with Crohn's versus those who do not have it. Now, researchers are exploring the idea of new antibiotics that attack MAP bacteria, which are a potential cause of inflammation in the human GI tract. This is very preliminary and will likely take years to develop, however, but it is promising to know that these studies are going on. I'm not spending too much time on ulcerative colitis, but it's another irritable bowel disorder in the same realm as Crohn's disease. It's also caused by a faulty immune system, and it causes ulcers in the mucosa of the colon and rectum, but nowhere else in the GI tract. Now, those with ulcerative colitis have symptoms similar to those of Crohn's, including an increased risk of colon cancer. Treatment usually involves drug therapy, usually anti inflammatory drugs, and immune system suppressors or surgery. Now, that covers the end of chapter 4. And there are lots of topics I did not discuss. These are ones that I picked out that I thought were important. I still want you to read the entire chapter and view all the materials on the Blackboard site. If you have any questions about anything presented here, just contact me. We can talk about it. I'd be happy to do that.